are here today to say, Congressman Snyder and Congressman Berry, you made the wrong prescription for health care reform. But not to be left out of the fun and games, last night Senator Harry Reid introduced his 2,074-page bill that has over 371,000 words, 183 references to taxes, and according to the CBO, which we all know is an underestimate, will spend $848 billion, raises taxes by $486 billion in the middle of a recession.
And doesn't count the doctor fee.
That's right. Not to mention the $436 billion cut from Medicaid and Medicare. My friends, I want to say that this bill is about as realistic as the 48 jobs created in non-existent Arkansas congressional districts.
District 6.
I want to speak to the changes that's going to happen in healthcare if this bill passes, either bill. $500 billion, with a B, billion dollars for Medicare. Medicare is already insolvent. How do we take $500 billion from a bank account that's already broke, that's already in the red? It comes from the general fund, which means taxes are going to go up. But let's talk about what it means to the patients. Medicare's already insolvent. So the only way that they're going to try to correct this is more cuts. And not just cuts to doctors' fees. This isn't just about me wanting to protect my salary. This is about my patient care. This is cuts to a reimbursement on medications, diagnostic tests, and yes, there are medications Medicare covers. The old ones with more side effects and more potential hazards. You know, America's great because we do great innovating care. We have wonderful technologies. We have wonderful innovations in medicines that makes medicine safer and safer and more effective. And if we cut this innovation, we lose health care. But even more sadly, if we cut Medicare, we lose those good innovations for our patients. And Medicare doesn't just cover our elderly. They also cover patients that have chronic medical diseases, ones that can no longer work because they have multiple sclerosis or Lou Gehrig's disease or breast cancer, and they cannot fight their disease and work. When they go on Social Security disability, they go on Medicare. So this is a loss to not only our elderly, but our sick. So we're going to expand health care to potentially, I know the debate, but potentially to illegal immigrants and take it away from our sick and elderly. Really? Is this what we want for our country? This is not what America is about. We take care of our own, and then we take care of others.
Kathy, you don't lie.
Is this public plan. I want to make one thing clear. When I talk to my colleagues, we want everyone to get coverage. Doctors don't want to just, we fight with insurance companies as much as we fight with the government. We want everyone to get coverage. We know there needs to be reform, but it has to be appropriate reform. But yeah, let's just take this public plan for a minute. What would this public plan mean? Well, they would put, I'm sure y'all heard the numbers, I won't get into it. The penalties are going to push small businesses into dumping their current health insurance, even medium-sized businesses, not just small, and going with the public plan. So more people are going to be pushed to the public plan. Well, let's think about this. The public plan will be similar to Medicare. Well, didn't we just discuss the problems with Medicare and Medicare funding? Yeah. We're going to have the same problems there. And I know that it's difficult to understand what it's like on my side of the desk, but I fight with insurance companies, and I go through appeal processes, and very frequently, as long as I can back my opinion up by good evidence, I can get things I need for my patients. Now, do you think that same appeal process is going to be in place with a public plan?
No way.
Has anyone here ever tried to appeal a penalty levied by the IRS? Were you successful?
No.
Thank you.
Yeah, my group is 60 plus, the AARP, the Association Against Retired Persons. We don't think they represent seniors, quite frankly. Follow the money. When I was a newspaper reporter, there's a no line, follow the money. If you follow the money, you'll find that the AARP ARP is making hundreds of millions of dollars.
Oh, yeah.
If you knock out all the insurance companies, guess who's left standing?
Yeah.
The AARP. It's already a Fortune 500 insurance conglomerate. I gotta tell you something, though. Seniors, and there's a few, I think, in this crowd, I want to sign you up.
Where?
I'll tell you what, back in August, you got the attention of the world, not just the country, this country, but the world. Going out there at these town hall meetings and saying, no, we don't want this 1,000-page monstrosity. And somebody said to me, well, Jim, they're going to go back and they'll come up with a 2,000-pager. I said, no way. Because, you know, you go home, members of Congress, I've worked on the Capitol 40 years, you know, you should listen and you learn and you leave. Apparently they weren't listening. They sure as heck didn't learn anything, I guess. Well, you said it. Let me tell you, I've been running a television ad all over the country about the $500 billion cuts to Medicare. And I started running it here in Arkansas. You may have seen it. We want to thank Congressman Ross for voting against the bill. A Democrat. We want to thank Congressman Bozeman for voting against the bill. And quite frankly, we've been chastising Mr. Snyder and Mr. Berry for voting.